Welcome to Bellingham Voices. I'm Marie Marchand. Our guests today are Jeff Brubaker and Laura Woods. Jeff is the community paramedic for the City of Bellingham Fire Department, and Laura is an intensive case manager at WAHA, the Whatcom Alliance for Health Advancement. Welcome to the show.
Thanks for having us.
Thank you. So let's start with you, Jeff. If you could tell us about the kind of how the program works with the Community Paramedic Program.
So my job is to reduce the 911 overuse by frequent users of that system and to create capacity within the emergency medical system of Bellingham.
So just a little bit of background for the viewers at home. The Community Paramedic Program was a pilot program for about a year, and then the City Council decided to vote for it and fund it, so it became part of the budget. So now, even though it's an ongoing program, there's a 2-year limit, and multiple paramedics kind of take turns applying for the job. How does that work exactly?
So currently it's a 2-year rotation, and the reason is because community paramedicine is much different than emergency medicine in that I do checkups, and a lot of that doesn't translate to emergency medicine. So after 2 years, your skills would deteriorate. You're not intubating people, you're not starting IVs, and you're just not doing that kind of stuff that you need to keep current in emergency medicine. Also, there is a burnout factor. Some of these cases are difficult and there isn't a good solution. So after 2 years, it's good to have a fresh person in to do that job.
That makes sense. So how much does it cost to call 911?
That is a complicated question. So one way to look at it is there are firemen and EMTs on duty 24/7, 365, whether they go on 1 call or 30 calls. So whether we go on additional calls for non-emergent reasons, it doesn't necessarily cost extra except for fuel to go to those calls and wear and tear on the equipment. But there's national standards for response times. And when these crews are tied up on non-emergent responses, then another crew from a different station has to come across town, increasing that response time. And then over time, that necessitates an additional fire station, additional fire personnel. And the longer we can put that off, the better. And that's where the cost savings is. So, I mean, part of it is you could probably just divide the budget of the fire department by the call volume, but that doesn't really give you a picture of how much it costs. So by limiting the growth of the fire department, by taking care of these non-emergent responses, because the fire department isn't set up to go on non-emergencies, taxpayers and citizens, they want the fire department to take care of emergencies. So, but there is a huge portion of our calls that aren't emergencies. So we just need a mechanism to take care of those that don't impact the actual emergencies, and that's what I do.
In a presentation to the City Council, your predecessor, Rob Stevenson, highlighted some statistics to demonstrate the effectiveness of a community paramedic program from other cities. And one of the statistics was that before the program, there was an instance where 2 people accounted for 70 calls.
Yes, well, it goes even further. So 2 people, 70 calls, 30 people, 500 calls. 200 people, 1,600 calls. So when you look at that population, those aren't emergency calls. And if you look at the annual report, that's an entire fire station's worth of calls that they're going on emergently for this very specific population.
Why are they calling 911? What are these for?
Well, the population that we serve is pretty vulnerable, and oftentimes they just don't feel like they have any options. Their only option in their mind is to call 911. So there's 6 basic reasons that they call that I've found over the year that I've been doing this, and that is homelessness, mental illness, substance abuse, aging and disability, complex medical, and one other. Fall risk. Yeah, so and a lot of that I can take care of non-emergently by going to visit them, but oftentimes I have to involve a case manager.
During its pilot year, looking at 3 months pre-intervention and 3 months post-intervention, there was a reduction of 61.1%. I mean, that is really significant, and that's exciting.
It is good. That's a good number, but keep in mind that the people that they followed were handpicked for the program. So, and it was for a very brief period of time. So I kind of looked at that number and I thought, boy, that is high. So I took everybody that we've ever enrolled in the program for any reason at all, and I looked at how successful were we with the entire population, and that's about 50%. So it's not quite as high as the hand-picked folks, but it's pretty good. And I don't know what the national average for success is. I tried to find it, but I think it's around there. So we're doing, I think, a little bit better than the national average, but I don't know how much better.
So how do you partner with the WAHA organization and the intensive case management program?
Well, like I said, we get the referrals from the EMTs and paramedics, and I try to figure out which of those 6 categories the patient falls into, and some of it I can take care of, like complex medical is kind of more in my wheelhouse, but oftentimes it's a social work issue. And so I make those referrals to Laura, and we go out and visit these people in their place. It could be a hotel on Samish Way, it could be a homeless camp. Sometimes they do have a place to stay or a house, and we try to figure out what is the unmet need that causes them to call 911, and then we work on solving it.
So Laura, now on to you. Thank you so much for being here. I wanted to give just a brief background of the program first. So the county executive asked WAHA to give a presentation to the EMS Oversight Board, and then they wanted to include it in EMS, but that didn't happen. It was voted down by 1 vote. Terry Borneman is a council member here in City of Bellingham, and he saw the data on this type of program and the efficacy. He really felt strongly that this program would do well here. So he came to his council colleagues and the mayor and said that he wanted this program included in the budget. And so everybody enthusiastically said yes and included it in the budget. So Laura, tell us about the basic structure of the program.
Okay, first of all, I'd like to thank Terry and Mayor Linville for supporting the ICM program. I think it's very beneficial for the City of Bellingham and our community. The ICM program entails 3 caseworkers. There's myself. I work with the EMS pod to help Jeff decrease the 911 calls. And there's another caseworker that works with the jail, and she works with decreasing recidivism and making contact resources with folks that are frequently incarcerated. And then the third person works with the homeless population. She's also embedded at Unity Care as well. She works part-time at WAHA and works directly with the HOT team, the homeless outreach team. And so a lot of the groups kind of interface as well. And for example, the homeless population might also be some of the folks that we're working with the EMS pod.
When you and I had talked before, I remember just being really impressed by your educational background and your professional background. Maybe you could talk a little bit about that.
I have a master's degree in psychology, which I received at Western Washington University. I have about 23 years experience in mental health and counseling field. 10 years experience was at the inpatient psych unit at St. Joe's Hospital. 13 years were outpatient in Seattle and Bellingham, working at halfway houses, case management, working with at-risk youth, working on hotlines as well.
Wow, we're really lucky to have you with all of your experience. What does a typical day look like as an intensive case manager?
Well, in the morning, I'm usually organizing my day. I'm doing more social work skills, such as making phone calls to other caregivers, just trying to reach clients to set up appointments, dialoguing with doctors and other care providers, setting up care conferences. And that's something that Jeff and I do as well, where we go to agencies and we meet with a group of caregivers. So that could involve doctors, nurses, parole officers, other caseworkers, social workers, and we meet as a large group and we talk about our client and how can we best serve them. And it's really helpful just to help smooth out communication as well as find the best resources for our client. It's a way to not duplicate services and just to problem solve on how we can keep our client from falling through the cracks and how to better serve them. So then I'll do outreach in the afternoon. Sometimes I go out with Jeff, and we'll go to meet the client where they're at. So again, that could be in a motel in Samish Way, it could be at the ER, it could be on the street, it could be at their apartment. Sometimes I accompany people to their doctor's appointments. So it just varies. It's meeting them where they're at. And a lot of time is spent doing outreach and just finding out their living situation and then finding the resources that they need. Some people do not have any resources, so I'll help connect them with that. And a lot of people already have resources, but they've just lost touch with their caseworkers or their therapists or doctors, so I'll help facilitate that.
What are some of the social service organizations in town that you connect people with?
We work really closely with Opportunity Council, Catholic Community Services, Unity Care, Northwest Youth Services, Northwest Regional Council, Lake Whatcom Center, Compass Health. Those are the big players. We also just started working with Lummi Healthcare as well.
My guess is that a lot of people you encounter are lonely and isolated. So I would imagine that when you two go out and help people and connect them with resources, that you give them not only a sense of hope, but a sense of community. And I was hoping you could share with us some stories, maybe one or two transformations that you've seen people go through.
Okay. A big part of our population is isolation, mental health issues, and substance abuse. And unfortunately, they have maybe burned some bridges, or they have family dynamics that aren't supportive. And so we help provide professional relationships with them. We build rapport. We try to gain their trust and have healthy communication and relationship. And that's just part of our job, is just to help them get back on their feet and not feel so isolated or lonely. And we also help try to get them a social network so they can connect with peers or counseling, AA, NA groups, any kind of treatment that they'll need. So I think it's helpful. We've got some success stories, and one was a woman that we met with, recently homeless, substance abuse, PTSD, and depression. And she just lost her housing, and she had a relapse. So what was really nice is that the community really came together. All of her resources came together. She was calling 911 a lot. So we worked with Opportunity Council, with the HOT team. We worked with Lydia Places involved in CMAR. And all the caregivers came together and just really supported this client. We work with the mission as well, and just to make sure she's safe, make sure she's sober. She got back on her medications that are really helpful. And so it's really nice to see the community coming together and supporting this woman in particular. And she was so happy. She said that we are like her family and that she feels well cared for. And she was very thankful and grateful to us.
Oh,
so that was really nice to see. And she'll be moving into another apartment this month. So.
Oh, great.
Yeah,
wow.
so it's very successful.
I remember when I worked at Friendship House Homeless Shelter in Mount Vernon, sometimes we would get phone calls from the hospital because people that were living with us in the shelter, they would put us down as their emergency contact on the hospital form. So there's a lot of people out there who just don't have anyone. So it's nice to know that nice people like you are out there connecting them with resources.
It's very common, and I feel like the more that we can work with them as on a one-to-one level, the less they'll depend on 911 and ERs and seeing the hospital as their only coping mechanism. So it's a great community for the resources that way.
I love this program. It's great. We're going to take a short break, and we'll be back after these messages.
Hey, wash those hands and that apple. There could be germs on them.
Good health habits are for everyone. Germs are everywhere. It's important to remember the simple steps that will stop them from spreading. Washing our hands often with plenty of soap and warm water, covering our coughs and sneezes with our sleeve, and staying home when we're sick are easy ways we can help stop common colds, the flu, and more serious viruses. These good health habits can even help prevent the spread of viruses that could lead to an influenza pandemic. Public health, always working for a safer and healthier community.
When every penny counts, burning only properly dried firewood makes the most sense. It's the most efficient use of your wood fuel investment and makes starting up that wood stove or fireplace insert quicker and easier on cold winter days. Now is the time to start preparing your firewood supply for next heating season. It can take from 9 to 12 months for wood to dry. For more tips, visit burndryfirewood.org. A message from the Northwest Clean Air Agency.
Even before my career started, I can remember times of a friend disclosing to me that their partner was abusive and feeling shocked and feeling sad and feeling upset for them, but not really knowing what to do with that information. My name's Darla Woolman. I'm a primary care physician assistant. I've been working in Bellingham for the last 15 years. I feel like every time you hear about domestic abuse, it affects us strongly. I'm deeply affected by it every time I hear about it. People talk because they feel like they have someone available who will listen. The more alone we feel, the more wrong it feels, the more shameful it feels, and we don't connect with people who could help us. The important things for the victims of domestic violence is to talk to somebody, to know that they can reach out of the isolation and that somebody will listen, that somebody will believe them.
You can be the one. Listen, believe, and help. To find out how, visit us at dvcommission.org.
Welcome back to Bellingham Voices. I'm here with my guests Jeff Brubaker and Laura Woods. So Jeff, tell us, is there a percentage of people who don't want to participate in the program that you encounter?
There are. I don't have that data specifically, but just off the top of my head, I would say there's about 5% of the people that just don't want anything to do with us. But they also don't want anything to do with anybody, because there is a mental illness and substance abuse component to it. So the good news is that of those probably 5% that don't want to engage initially, over time, I'll visit them over and over. I can be persistent, and most of them will, and most of them I can help. So it's a pretty small percentage that don't. In fact, off the top of my head, of my list of almost 300 people, there's only 1 or 2 people that absolutely want nothing to do with our program.
You mentioned mental health and substance abuse. What are some other challenges that you face in your job here?
Well, homelessness is a big problem in this town. I think everybody can agree on that. And it's a popular place to live. Bellingham is a great town. So people move here, and the vacancy rate is, as a result, very, very, very low. It's less than 1% in the county and probably far less in the city. So people who normally could rent and have first month's rent, last month's rent, deposit, and references can usually find housing, but our population does not have access to that. So they are challenged in this environment to find housing, and we're challenged to find it for them because of that vacancy rate. So that's I think the biggest problem.
Mm-hmm. Well, thank you for being on the show today. I have one last question. It's something I ask everybody, and it's, what's your favorite thing to do in Bellingham? So Laura, what's your favorite?
My favorite thing is walking in the woods, specifically in the 100-acre woods, my backyard, and also the interurban trail. Those are my favorite walks.
How about you, Jeff?
I like skiing at Mount Baker, which I recognize is not in Bellingham. I like biking in Bellingham, and there are a lot of good breweries in this town, which seems like there's a new one opening every week, and they're kind of fun to visit.
Yeah. Well, great. Wonderful. Thanks again. We appreciate your time here today. Thanks for joining Bellingham Voices, and see you next time.